this is the first follow-up after 24 hours, 9/10/2020. After giving the medicines in first 24 hours, his nausea vomiting has reduced. After he was constantly having those after admitting also, nausea vomiting reduced. He was better. Epigastric pain was mild better after eating only. And in general he was getting better. So I continue same dose. After reviewing only we can tell the patient what next dose we can give for next time. After second day, third day, then only we can manage. Suddenly on day first we cannot tell you take so and so, go and home, we will see later after 7 days or 8 days. This was the mild acute on chronic, chronic on acute state it has come to me. The one symptom started, I knew the medicine has acted proper way, I should continue the same medicine the same dose. If the medicine has not acted or medicine has not changed, any slight alteration is not happening in the patient or no improvement started, I will have wait or I will increase or decrease the dose accordingly. Then I should wait again and see what is the reaction of the patients, but do not change medicine frequently. Okay. In second follow-up, 2 November 2020, after long back of the patient has not trusted. See, initially he was going to urologist and coming back to me. He was going here and there. He was asking where to go, either to take homeopathy treatment or not. He was visiting many urologists in nearby. He has also had visited many urologists opinion regarding dialysis, and many doctors or many patients are towards allopathic view. They have never heard that homeopathy can treat dialysis, homeopathy can treat cancers, or homeopathy can treat such a pathological cases. So everybody says you go for urologist, do dialysis. There is no chance, and homeopath cannot survive you. This is the common words we heard from the even MBBS or urologists also. They cannot trust also. They have never seen the cases. You should show cases in a general CM is there. We should show like cases so they can trust in homeopathy also. All they told kidney is completely in failure. There is no chance, and you have to take lifetime. And he asked also, there was 40,000 cost for 1 month per 1 month. They take I think 1500 or 200 rupees, 2000 rupees for per dialysis. How much the waste product they should remove from the body, and total month charges for 40,000 per month, and he has to waste all those money lifetime. Already he was in difficulty financially also. So again he came to me and I will continue the same medicine, little improvement is there, we will see what happens next. Then he was better after medicine. I gave him next potency arsenic 0/2 after finishing there. I increased the dose by 10 drops, 10 stroke I gave, 50 drops in 100 ml water and 2 spoon BD. Previously I gave 1 month TDS, then after I gave BD as his previous symptoms was reducing and he was in better way. So I continued the medicines. Till also he was not taking any other allopathic medicine. He was without allopathic medicine, but he was searching whichever is the best doctor where I can get the proper treatment for kidney failure. This is the result in 11/1 November 1 November. His creatinine came down from 6 or 8 to 4 after 1 month of the results. And still his urea and uric acid were higher side. I have now suggested diet immediately, as he visited only once or twice a month. If he is continuing proper, I can suggest, I can tell him properly. As he was not continuing regular, so I had not suggested diet properly. When he came back properly trusted, I suggested a diet, you continue with the diet. In third follow-up in December month, he was better, not completing, but mild acidity and burning was there. Still he was having those mild symptoms. Their family member review that after homeopathy treatment he has not suffered from any symptoms in last 2 months, so they can continue the medicines. He is better, his health was also better, we will continue the medicines. Then I continue after 1 month also, LM3 arsenic I gave, 10 stroke, 50 drops in 100 ml water and 2 teaspoon BD, same way. Again after this also his creatinine level was that much only, 4.97. Blood urea and uric acid level was higher side, and still he was not changing his diet. This is the reason. When we give the medicines within 15 days or 20 days, his other parameters should come down. After even if we are giving the best or best antipsychotic medicines also, it will not work if the other factor is making the hindrance in a cure of obstacle to cure. And one has mentioned, we should see obstacle to cure. What are the obstacle to cure for those cases? He was again eating outside food, anything. He was going and going, as he was to go to work, come home and do everything for children also. So I suggested diet and it came down. In January, fourth follow-up, there was no pain was there, epigastric pain, which was mild was nature. Fullness was not there in nose region, no acidity, but still same condition. I told him again we suggest na we should continue diet. Without diet we cannot get complete cure. Otherwise they blame us more. Still he was not getting seriously regarding healthy foods and diet. Huh? Again I continue with the next medicine in January, arsenic LM0/4. Same dose was again same, 10 strokes, 50 drops and 100 ml water and 2 teaspoon. Again in fifth follow-up, he became serious. I gather his all relatives. I told him, this is the last chance I am giving. If you are improving, then I will continue the medicine. Otherwise, you stop the medicine and go for dialysis. Look at it. Then we cannot wait now. How much we can stress? How much we can wait for the medicines? We can result. As any other pathology can develop because of those high uric acids and high blood urea also. You know, and it can comes with the heart complaints also, or any other complaints can suffer also in future. So I told him, his family members, we should strictly follow given diet. Otherwise, I will stop the medicines. But he was better na, not suffering from anything. He was continuing with his own lifestyle pattern. It is wrong. Actually, he is suffering with severe kidney failure and he should follow properly. Otherwise, he cannot get completely recover. You know. Then after not complain regarding abdominal pain, weakness after working he is coming. As I restricted him the food, according to me, he was not taking complete foods. Pallor anemia. When I told na, he was saying, you told me because of that diet my weakness came back. I was having weakness, my HbA dropped down. Actually, these symptoms are because of kidney failures only. Anemia will happen, weakness will come. I was knowing those symptoms will come. You have to go properly with foods and all everything. And he was eating only this much only, this much sabji, this much roti, and only small amount. But he was craving for other outside food. So he was in the home. He used to take small diets. Well, you should take properly, na. Which food I am suggested? He was taking only small diet. Well, you increase the food quantity. It will get better. The previous symptom will go. The creatinine came down to 2.5. Again, I continue arsenic 0/5, same doses, 10 stroke, 50 drops, and 2 teaspoon. In such a case, what happened? I repeated the eGFR level. eGFR level came to 30 within 6 or 5 months, which is what 8, very severe. And corticomedullary filtration rate was better as previous, which was in difficult phase. It was very better for me. Above that, we cannot treat the patient. It is in very severe conditions. And in such a patient, the creatinine or those level will remain till 1.5 or 1 or 2. Below that, we cannot decrease the patient in such a case. We should know also na, how much it can remain constant. Below that, it cannot come. I gave the medicine further also, but below 2, it never came. Only 2 or, but he was free from other symptoms. And now his HbA1c is 40, sorry, this month. eGFR is 40. Now he is properly following properly. In 6th follow-up, in this one, March, no complaints of epigastric pains, no weakness was there. HbA was increased to 11. Creatine was that much only, 2.210, not it came below. eGFR was 30 that time I tested. I gave him arsenic 0/6, same doses, repetitions. In 7 or 8 after March, I started treatment in November, December, January, February, March. In 8 or 7 follow-up after 6 months of the review, no change was there. So I told him continue with the proper diet, otherwise you can get landed in other area. So by continuing, there was no change in the creatinine levels in other area. So I continue with the sulfur 0/1 and 0/2 for Next 3 months I gave him, and because of long standing damage we cannot recover him completely. And after giving sulfur 0/1, sulfur 0/2, this was a common dose which I gave him last next. The creatinine came from 1.8 or 1.7, that much only, not came below down, bus. And I stopped the medicines. And now also he is living without dialysis. Now 18, 19, 20. And from 4 years it had happens. Now he is not suffering full dialysis. Again he sent me 10 or 15 patients in that time of same category. He came in 2023 with other patient. He told my health is okay, I am working properly. Whatever you are giving, I am eating in proper way. And many other patients came. But his creatinine level I checked again in 2023, 24. Now also this year also I checked. It is 2 or 1.8 level only, not came below downward. But other parameters have improved. Health has improved. The quality of life has improved. And one more symptom he told me at this time when he came, I was having diabetes also, which he forgot it. And he told I was having diabetes also that time, and I was not taking any medicine. So I did not did a test of diabetes also. But because of your medicine, my diabetes also got cure. Ha. He told me I did my diabetes test also. "Bolo, you are not suffering from diabetes, but how came? Now you give the medicine na. From that my whole medicines was stopped. And now I am non-diabetic. See, whichever the symptom we cover, na, those symptoms are regarding those organs. Uh, huh? And see, and I told him you have to monitor your RFT levels, blood urea, uric acid levels, EGFR level, blood pressure monitoring. Blood pressure also goes up because of waste products in that. Okay, thank you. Huh? Sulfur, na? Whenever the case has finished, na, all the symptoms are gone from my medicines, na, I see no other symptoms are there. I wait till 6 months or 4 months also, till his symptoms are coming or not coming. After changing diet or going anywhere, I wait for a time being. Then only I give sulfur. By I end every case with sulfur, sulfur 1 or 2, or I can give 0/3 also, same dose BD. Hmm. Initially, I was practicing in 100 ml water by drop method. I was not practicing directly 5 ml, 10 ml. I was giving low doses for drops potency. Now, last 2 years, I am giving directly for CKD 5 ml, 10 ml. I can take the patients like that. Okay. Huh? In arsenic album, those symptoms are there. Uh, huh? Uh, I can show a laptop.